Numerous factors have been reported to influence lactation. The role they play is hard to assess. It is generally based on either clinical impression or inclusive evidence. Views on the importance of certain factor are conflicting. From time to time, a different factor is regarded as the most significant. These include the genetic or heritability, nutrition, physiological and environmental factors, and lastly, the metabolic disturbance and mastitis. Genetic makeup of lactating animals plays a great role in variation of milk yield and composition. Lactation is therefore a factor of genotype-environment interactions. Identification of various genetic factors involved in regulating the lactation and involution, especially in farm animals, would enable to reveal the molecular basis of milk production. Here is the amount of variation which represented by H2. There is 25 to 27% of variation of milk production, while in lactose, protein, and fat has 55%, 49%, and 58% variation respectively. However, if there is no amount of variation, the fat and protein would be 5%, while the milk production and fat and protein in some cases would be negative 2% and negative 1% respectively. Since lactation is not only solely based on the maternal heredity, nutrition and physiological and environmental factors should be taken into consideration. The most limiting nutrient in early lactation is the energy, as it has direct relationship to the amount of milk produced because the content of lactose in milk is tightly regulated. In line with this, the conjugated linoleic acid or CLAS formed by biohydrogenation of dietary fats in the bovine rumen produce an important source of many health benefits to humans. The recombinant bovine somatotropin or RBST increase milk production by stimulating the mammary secretory epithelium to increase its metabolic rate, decrease cell aging, improve nutrient utilization and partitioning. Lastly, heat stress, which begins to occur in 20 degrees Celsius, may also affect the lactation of animals resulting in low yield. The last factor would be metabolic disturbance and mastitis. It is important to note that pathophysiological processes affects the performance of animal. Ketosis is metabolic disturbance in which there is an accumulation of ketone bodies in tissues, including milk and excessive ketone presence. This may result in mammary tissue obstruction. Next is the hypocalcemia, wherein there is a lower than average of calcium which can limit metabolic function of the animal. Alter muscular activity may result in animal becoming a non-ambulatory and if not corrected could lead to death. The most inflammatory disease of mammary gland is mastitis. One fundamental cause of mastitis is the injury to the teat canal from repeated stretching that occurs with the milking process and consequently the establishment of infection. The presence of damaged connective tissue limit the area and ovuli can proliferate, thus reducing the milk production potential of the gland. Those therapies directed towards the treatment of mastitis often combine anti-inflammatory and antibacterial agents.